Hey everybody. Sorry, the lighting in this part of my basement is not as good as the other part because like these little highlights are there. But all right, in a few minutes, Dr. Nancy is going to join me. She's known as Sports Doc Nancy, and she will be joining in a second. As you guys know, we have, let me just put the hashtag up in case you guys have missed the post. We have Fat Squat Fast going on right now, which is our squatting challenge. So, what Sports Doc Nancy is going to show us today. She's going to show us how to do a proper squat. She it's basically her specialty in terms of being a sports medicine physician. And so she noticed that some people were not doing squats correctly. And so she was so gracious enough to come on and show us how to do a squat properly. So I'm going to give her a few minutes to join and send the request so we can start. But hey, if you guys are participating in the squat challenge, why don't you drop a comment? Tell me why you're doing it, how it's going. Tell me why you're not doing it, if you're not doing it. And let me know what questions. There we go. There's Sports Doctor Nancy, and we're going to go live together. And it's connecting. Yay! Hi,
Hello.
how are you
How are
doing?
you? I'm good. I
Good,
came to
good.
my office to see a runner who had fallen and twisted her ankle and landed on her knee, make sure she didn't need x-rays or cast or anything. So I'm still at my office, but I'm happy to help
Yay.
share my info.
All right. Well, just before we begin, I'm going to let everyone know, though Nancy and I are both physicians, we're not your physician. And so this is for informational purposes only. Obviously, if you think you're not doing something right or you have pains or yada, 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 make sure to contact your own personal physician so they can get you hooked up appropriately. So, Nancy, why don't you start off though by telling us about yourself and your practice, and then we can get into how to do a squat properly.
So my training is in family and sports medicine. I'm from Chicago. I moved to California to do my sports medicine fellowship so I wouldn't be on the football fields in Chicago, which I think was a very smart move. So I've been to California since 2003. And after a couple different jobs and a couple different orthopedic groups, I opened my own practice called Remedy Sports and Regenerative in the Bay Area outside of San Francisco. And so I've been in practice for a year and a half, and I treat patients who have orthopedic issues non-surgically and try to keep them out of the OR using, simple conservative measures that are simple for me. And some people are like, I've never heard of this or I've never heard of that. And, knowing the right diagnosis and what they have is really valuable, and then what they can do to get better. And so I give them feedback. And one of the most important things is preventing future injuries, find out what they are doing wrong so that, they don't get further tennis elbow or they don't get further shoulder rotator cuff issues or ankle sprains. I see a lot of people with knee pain and shoulder pain are two of the most common areas that people get overuse injuries, more so than, your twisted ankles, an acute injury, or, if you fall and break something, that's an acute injury. But I'll see both acute and chronic issues. And so, a lot of times people do squat challenges and different things, especially like New Year's. They're like, I'm going to get all fit and I'm going to do all this great stuff. And then, if they do it wrong for 30 days, then they're like, oh man, I just like I've never had pain before. Why are my knees hurting, or why are my hips or my ankles hurting? And so things like squats, you need good ankle mobility, you need good hip mobility. And, you know, and you don't have to go as deep. Like if you're somebody who's just starting out on trying to like exercise at home, especially right now when people are sort of dabbling and maybe doing different things, they feel like, okay, I got to do some exercise because my gym is closed. And, you know, so a
Right.
lot of people go to the gym, and a lot of them do form right. And there's people that I see at the gym and I'm like, oh, I just want to go up to them and correct their form because I don't want them to become a patient or have pain. But, you know, I try to keep my, be respectful. But if it's something really bad, I'll be like,
Right.
you're sort of putting yourself at risk. Let me just help you, you know. But
Yeah.
people don't always want to be told what to do. But coming from a sports doctor who's been treating patients for their injuries for 20 years, I think I have a good handle on things.
I
I'm
would
not
say
perfect.
so.
You know, there's, you know, physical therapists and strength and conditioning coaches are really great. You know, some personal trainers are better than others. Some have more expertise to kind of fine tune where things might be, you know, adjusted. But like
Mhm.
a squat can be very, very, very effective for quad strength and glute strength. And I reached out to Cecily because I saw a couple of people who are really excited and doing their squats, and I'm like, oh, they're doing it wrong, they're gonna hurt, you know.
Right.
So she reached out and said, hey, will you kind of go over some of this with me? And so I'm here to help.
Yay. Well, no, that's awesome. And I think one, you know, you touched on a few things, and I'll just highlight one before we get into the squats, though. You know, I think there's a common misconception, no pain, no gain. And that is not correct. So, I mean, like right now, I am sore because I did a total body strength training, you know, yesterday, but
Right.
it's muscle soreness. Do you know what I mean? It's
Oh
not
yeah.
joint soreness. And so I don't, you know, correct me if I'm wrong, but I don't think that your workouts should leave your joints hurting. You know, then you're not doing something correct
Right.
or
Well, so
correctly.
you want to protect your joints, you want to protect your tendons and ligaments
Mm-hmm.
surrounding the joints. The soreness that people get after a hard workout, I mean, that's, if you know, especially if you're trying new things, you're going to get sore. There's something called delayed onset muscle soreness,
Mm-hmm.
DOMS it's called. And so it's usually 48 hours after a hard workout. So you might like do a bunch of squats on Monday and feel like, oh, Tuesday I feel pretty good, and then Wednesday hits, you're like, I can barely get out of, you know, off of the toilet or, you know, a chair or something. So the the soreness is one thing. You know, if you're sore for like a week, that you probably overdid it.
Okay.
And I've had time, you know, it doesn't mean that necessarily you have to go to the doctor, but you know that whatever you had done was maybe over your, you know, capacity to do X amount of, you know, squats or weights or whatever you want to do. So the key to not getting injured overall is listening to your body, doing the right form, and then slowly progressing, and not
Okay.
trying to like, you know, say, okay, I'm going to do 50 squats a day, even though I never do squats ever, you know. So
Okay.
that you want to be cautious about, because you don't want to end up with knee pain. So I have a little model, since I'm still at my office. Here's the knee. And
Okay.
so when you do a squat, you're bending about 90 degrees. Oops. And this thing always pops out. I need a new one. But yes, I just tore the medial collateral ligament. But so when you do a squat like this, there's a lot of pressure that happens between the femur here and the kneecap here. So when you're in that 90-degree position, and if your knees like really fall far forward, you're putting a lot of force between that space there, right in here. And so the important thing with a squat is not to lean forward, but to lean back. So you
Okay.
have your heels bearing most of the weight, and then you're sitting as if you're sitting into a chair. So I can show you. Do you want me to show you?
Yeah, I'll have you show, and then I'll try to do it with you too.
Okay.
Okay, I have a little thing. Hopefully
Are
this.
you in a movie theater in your house?
We have our basement. So, granted, full disclaimer, this was like this when we bought the house, so we did not do it. But this
Well,
is
you
why
did a
we
good
bought the
job.
house because
No,
it was
it's all
there.
good.
But it's like I don't even know. Am I far enough? Hold on, let me angle so you can actually see my knees. That's kind of. So you're saying when we do a squat, basically sit back
Yes.
like that. So I can't go as low when I do it like that. But that probably means because I'm doing it correctly. Like I
Right.
feel like because if I go slow, I almost feel like I'm gonna fall back.
Right, right. So if the correct form makes it harder, that's a good thing, you know.
Okay.
And so you just modify from there, because
Okay.
if you're able to do it and you do it wrong and you do it wrong over and over and over again, you'll end up with knee pain eventually.
And you
But yeah,
said,
that's good. And your arms go forward like that, so you're counterbalancing. And if you
okay.
just imagine, like, one way to practice, like the leather chair behind you, you can like hit your butt on the
Oh
leather
yeah,
chair as you go back.
that's
Does
a
that
good
make
idea.
sense?
Yep, I have a chair.
Oh, okay.
Even
And
though
I'll
the
show you,
chair
because I have a chair here as well.
is super low, but
But a chair is a good, you know, for someone who's just starting, a chair is a really great way. So you bring your feet forward, because I think you're a little too close.
too
Like
close.
step,
Okay.
yeah. And now just tap your butt on the chair and then come back up.
It's low. I'm like,
And you know, you don't, and not everyone can go as low as other people. So when you're working on your developing your quad strength, you know, maybe you only go like 30 degrees down instead of, or 45 or 50, and that's what your norm is, and then you can, you know, progress from there and improve. And so, you know, if you're not somebody who does a lot of, you know, weight training or strength training or lunges or squats, you know, right away you're not going to be able to do the proper form in a lot of them. So,
right.
you know, I love the challenge, but like I think you wanted people to do their age, and I'm
Yes.
47. So, you know, I did 47, but you wanted me to do it 3 times. I'm like, that's 150 squats. So for somebody who isn't working out, that would be really hard. But for someone who is, so I usually tell people, like with any sort of challenge, like find your normal, you know,
Okay.
so if you can do 10 in great form, or if you could do 20 or 30 in great form, and then you could take a rest and you could do another 20 or 30. And I think it's super cute. I think you're like, oh, just do your age. But older people, oftentimes we get weakness as we get older. And if someone hasn't been working out, that's going to be a bigger challenge than if, you know, so you might even reverse it. Like if you're 20, do double or triple. But if you're
Right.
60, do divide by 3, you know?
Do 20. Yes. And then we put a disclaimer in there that, or a good place to start were 3 sets of 20. So
Yeah.
maybe that might just be more realistic. I may have to go back and do that, because I noticed like I went lower, you know, I could touch my bottom, my booty to the chair. But when I went slow like that and kind of like kept a mental note of like where my knees were and all of that, when I
Yeah.
went slow, I was like, oh wait, this is harder. So my form probably also has been poor, and that's probably why I've done, you know what I mean, like this was harder for me to do just now with you than when
Right.
I'm doing it like to my workout video or like whatever I'm doing.
And you know, and you know, some instructors are really good about cueing you what you should be doing. You know, in yoga, people are always walking around making sure people get the right form. But you know, if you're doing things at home and you have no idea and you think you're doing it right, you know, then you know, eventually see a doctor or a physical therapist or a chiropractor, and they're like, oh, what have you been doing? You're like, oh, I've been doing these workouts. And I always have my patients show me how they do a lunge or how they do a squat, because if they're doing it incorrectly, I can right then, you know, right the wrong. And if they're like a 16-year-old teenager, you know, if they do it wrong for the rest of their lives, like that's a problem. So if I'm able to say, hey, you know, I know your gym teacher's got like 40 kids to watch over, they're not kind of keeping, you know, track of you, you know, this is what you need to learn to do it correctly. Can she demonstrate how low we should go? Yes. So I'll show you lunges and I'll show you squats.
Okay, perfect.
And I have shoes on. I think it's best to do with shoes because that stabilizes your ankles. If you have weak ankles, sometimes you kind of collapse, and that's a problem in itself. But I think ideally having some shoe support is good. So I am going to move my camera, and I am going to see. Well, I think I need to bring it down. Okay.
Yeah, that's what I had to do. I had to angle mine down.
Okay. So you'll just see like, I want you to be able to see more. Maybe I have to go in my hallway. Sorry, I keep moving things.
Oh, no, you're fine.
Okay. And I'm gonna angle this a little bit if I can. Ah,
And
now
some
it's going
it's
crooked.
like I do lunges and squats barefoot, but what Dr. Nancy is suggesting is that you use your shoes. I mean, wear your shoes. So that might be something.
All right,
I work
I
out
may
with
have to
my
just bring
shoes
this
on.
to the ground.
Oh,
Okay.
that's perfect.
Okay. So you, if you're going, you want your feet to be about the same width of your hips. So this is the position forward. And if you bring your arms forward, you kind of counterbalance. And my knees, if I like put my hands here and drop them down, they don't pass my toes.
Okay.
So if I just literally, like imagine you dropped a string or a fishing line, drop it down from your knees, they should not come above this way. Does that make sense? So I'll show you from the side. So you can't see my feet.
Okay, now we can.
See how my knees aren't past my toes?
Mm-hmm.
Does that make sense?
Yep.
Someone's at my door. I have no idea who that is. Can you hold on 1 second?
Yep, we can hold on. Yep. Duty calls. She will be right back. And then, yes, we'll ask Chris Clark C2, how much should you bend your back? Because that's another thing that I think a lot of people do that's incorrect, is they bend their back too much.
Okay, sorry, I'm back. I didn't know if it was a delivery.
Oh, no, you're fine. You had a question, too, about how much should you bend your back while you're doing the squat? How much should you be leaning forward or not leaning forward?
So your butt's going to go down. Your back should stay pretty straight, but you want to keep your shoulders up. So I'm coming, this, you don't want to sway your back. You want to kind of keep this straight.
Mm-hmm.
And if you can get to 90 degrees, that's great. But if you can only go here, that's fine. So, if you just want to go like that, as long as your knees are not doing this. So the gals that I saw who were doing the exercise, they were doing like this. I don't know what they were doing. They were really going forward. They were more like bouncing on their knees. So that you don't want to do. You want to always act as if you're sitting down onto something. Does that make sense?
Yes, that makes sense.
So like with a chair, a good way to test yourself, you're going to put all your weight in your heels, okay? Not on your toes, on your heels. And you're going to sit back. Let's see. Okay. Sit back, touch the chair, and then stand up.
Okay.
If you want to do it with a chair, you could do it that way. That gives you like the correct form. So, getting to 90 degrees, and then I'm stepping up with these muscles here. Right. So you don't want to use you don't want this bouncing thing going on, because that's going to put a lot of pressure on the front of your kneecap, and you don't want that.
And then lunges would be, yes, and lunges then would be the similar concept. It's just one lunge at a time, but you are not bending, you're keeping that 90-degree bend as well.
I'll show you that. Okay. So, maybe I'll get out of the doorway. I'm sorry. I'm just trying different positions. Okay. So let me try. I've never done this before. I
like your office.
Oh, thank you. I love my office. I just want it to be. Okay. All right. I got to put you on the ground. Sorry.
No, that's fine.
So this way. Okay. So when you do a lunge, you want to go back. You see how my knee's at 90 degrees? My butt is down. So you want this kind of thing, not this kind of thing.
Yeah.
Because that is going to hurt your knee. It'll hurt my knees. So you want your knee and your calf in line with your ankle.
Okay.
You see that?
Yep.
You don't want it doing this. This is what causes a lot of my patients to have knee pain. So you want to go straight down and up like that.
Yep. Okay.
And if you can't go to 90, you got to build up strength to do that. So, if you just kind of go like that, as long as the knee isn't tracking too far forward, I think you're in a pretty good way. Does that make sense?
Yes, that makes sense. And then the other thing is that then you were noting that when we do the squats, you really should be feeling it in your glutes, right? I mean, that's like the point, glutes, hamstrings, probably.
You don't feel it too much in your hamstrings, but
Not
you
hamstrings.
definitely
Okay.
feel it in your glutes. So, when you're doing a squat, let's say you're going to do 20 squats in a row,
Uh-huh.
you know, I tend to bring my arms forward and back like this,
Uh-huh.
but you could just leave your arms in front. But the whole idea is to keep your weight into your heels, and then
Okay.
you'll be more likely to do it correctly.
Okay.
Squeeze at the top. Yes, you could squeeze your butt at the top. That's actually a pretty good thing. And you can modify it. Like if you're the person who it's really, really easy, you can hold a weight like in front of your body. Like,
Like a dumbbell or something.
if you have like a 20-pound weight or something, you can hold it in front, or you could put weights on your shoulders. Some people have a bar that they can put behind them, if you have a gym. Right now, when people don't have access to gyms or weights, I saw something great, which was find a backpack and put crap in it. So, take your like medical, like big old books, or, take a pound of flour or whatever it is, 5 pounds of flour or rice or some other things, and you can load your backpack. You could put the backpack facing forward, like in the front with the straps here. And then, so if the weight's here, you got the backpack here, then you can add more tension for your knees. So, some people everyone's going to be at different levels. So
Right.
I think no matter who you are and your age, you just need to know your norm, what you can do. And if you do too much, like before I started lifting weights, if I'd be like, oh, I'm going to lift weights today, and I'd do like triceps, like literally my triceps would be sore for like a week because they were not used. And I'm like, oh, I can't do anything. So starting slow and going up from there, I think, is your best way to feel like you've made progress, and that the next day and the next day you can still participate. Because if you get so sore that you're out for a whole week because you overdid it, then you're like, oh, I can't even do the challenge that I was really excited to participate in. So I see, I love challenges, like plank challenges or push-up challenges. I saw a lot of people doing the push-up challenges, and tons of people were doing push-ups wrong. I was like, wow, but they were just trying to get in their 10, and they're like, so I just wanted to share some techniques that if you work with a trainer, they're going to help you with that. But not everyone can afford a trainer. And
and right now we probably shouldn't even be around trainers, right? So because we're supposed to be social distancing.
Yeah, what people are doing is
FaceTime probably, or virtual.
Like I talked to a patient who is doing like FaceTime or Zoom training sessions. So the trainer's telling them what to do at home. But right now, working out at home is a whole different ballgame, because you don't have the whole group of weights selection. You don't have 10 and 15 and 20, but you can modify. You could take a gallon of milk and, whatever. I don't even know what a gallon of milk weighs, but you could take a gallon of milk and go outside and put some dirt or rocks in it. And then now you have a heavier thing, as long as the plastic will sustain, will hold that weight. But I think, you gotta be, creative. You've always heard, I'm sure you've heard of, like, using peas or, soup cans. I mean, soup cans gotta weigh like a half a pound. So I don't know that it's getting you that much benefit, but I really like the backpack idea. Like, if you really want to build strength and you don't have any weights at home, that's one thing you can do. But you do have to be cautious with your back. Somebody asked, you don't want to arch your back when you're doing these things. So that leaves me, I forgot to say, you want to contract your core while you're doing this too. So it can be a totally full, water jugs. It could be a full body workout if you get your core in, you get your butt, you get your legs. So squats are awesome. But if you squeeze your core, and what I mean by that is, like, here's what I tell my patients. It's like, you're trying to look sexy in your swimming suit and you tuck everything in. You're like, I'm holding everything in. You're like, that's the feeling you want, or you're trying to put on like tight pants and you kind of suck it in. Feeling of sucking it in can help contract that core, which will protect your lower back, which will help your pelvis be in the right position. So core is really, really important. So if you're going to do anything more, I would do some planks too, because planks are really good. I can show you how to do a plank. You want to hear that?
Yes, because I actually hurt my shoulder. The only shoulder injury I've ever had was trying to do the planks where you do the, you know how you do you start on your forearms and you take one arm and go up.
Yes, yes.
And I hurt my shoulder in the up motion because I wasn't doing it correctly.
Well, and honestly, it's really hard. I know you do the Beachbody workouts too, and you know, and so you're here, and then you're pushing up, and you're going down and up. And that's really hard. And so, you know, you want to maintain form, and if you can't do it with the proper form, you just shouldn't do it because you will get hurt.
And that's what I should have done. I should have just done a static plank.
But you didn't know. You know.
Yeah, it was.
You wanted to do what Autumn told you to do.
I did. I was following Autumn, but it was my fault.
Well, so for a plank or a push-up, it's the same. All right, I got to move this back again.
Okay. Not to wear you out, if you want to show people a push-up too, because I feel like a lot of people don't know how to do a true push-up.
Well, I just taught my kids this morning, like, you know, so a push-up position and a plank position are basically the same position. You know, you want to put your arms below your shoulder, and you don't want to fully lock your elbows, just a little bit of a bend. And you want your neck not to go up or down. You want it to be neutral. So looking at a dot in front of you is helpful. And then when you in the back, like you want to squeeze your butt, you want to squeeze your thighs, like squeeze them together. So you're just a tight board. So, and I told my kids, and I think it's helpful if you spread your fingers out a little bit, it helps you, I think, a little bit. You can kind of grab a little bit with your fingers. So, all right, let's see. All right. So a lot of people, their hands are not below their shoulders. They're like something like that. Yes. You know, they're somewhere else. So you want them to be in line with your shoulder. And there's different push-ups. There's wide push-ups, so your hands are further out, and then you do the push-up. And then there's ones where they're really close, and you bring your elbows to the side, and you do a tricep push-up. But most push-ups are just, they're between the wide and the narrow. And so this is a plank. You don't want your butt up. Like a lot of people do this, or a lot of people do this. So you want to push your, you want to kind of round this part of your back. You want to kind of push up, not like allow yourself to sink down. Does that make sense? So kind of like that. Instead of this, more like that. And then your butt is squeezed, and your thighs are kind of squeezed, and like everything's kind of tight. You're squeezing your belly at the same time. So this is the proper form for a plank, and at the same time, these muscles are all cinched in. That's the point. So a plank is great because it's arm strength, it's shoulder strength, it's core strength, it's glute and leg. So it's got a lot of components to get a kind of a broad strength in. So, but if you're in your position, you're not down, you're not up, you're just like a board. That's why it's called a plank. Right. And then, your push-ups are going to be your elbows are going to be not next to your body, and not like a wide one. A wide one, you're like this. A regular one, you're like that. So I had someone describe it like as if you're like, let's say someone's throwing you a basketball or something, pushing you like that, or you're just trying to push somebody away. It's kind of that same feeling when you're doing a push-up. You're kind of pushing up and pushing away. Right. And
like when you're doing a chest pass almost. I just moved my phone.
Right.
Like when you're doing a chest pass in basketball.
Right. You want all these muscles to be strong. And so a lot of people, like, they just really, in a push-up, they collapse their whole upper body down. And it's more like you need to push it up and back. Does that make sense?
That makes sense. No, it does make sense. That's really helpful. And I think probably, like you said, a lot of people do them and don't realize that they're doing it incorrectly, and then they have pain, or they just feel like, oh, maybe I'm just not strong enough, or whatever the reason. It's just like, no, the form isn't right. So, I mean, important that it's better to do fewer reps with proper form until you can build up to doing many reps,
Right.
rather than doing many reps incorrectly. Like, you're not winning anything, you're actually hurting yourself.
Right. And the other thing to think about, I mean, your community, they may be all different weights and all different, I treat mostly athletes. So, they're already kind of versed in how to do a lot of different things, but they can still be weak in different areas, or, they might be breaking down their form when they're trying to like get their ego, they do too much. But,
Mm-hmm.
if you're just starting out, you may not be able to do a plank or a push up on the ground. And so I usually tell people, like, just do it like on the edge of your bed. And so, so you're elevated, and you can even, so here's my chair. So if you have a chair or, a bed, you could just do it this way, or you could do it on your elbows, So
that's a good idea.
But if you do it high, it's so much easier. And if you can master that, then you go to the floor, and you can also do push-ups up here, and that makes it easier because you're taking some of the gravity away. And so if you don't want to feel defeated when you start this stuff, because everyone's starting at different positions. Like I can, like at home, where I'm trying to get the kids to do a push-up challenge where I want them to do push-ups this month and see if they can like gain a few more by the end of the month. And what my daughter can do is very different than what my son can do. And he's making fun of her like a stupid little boy would do, like picking on his sister. And she's like, why are you picking on me? I'm like, yeah, why are you picking on her? She's going to do what she's going to do. He's going to do what he's going to do. And I'm going to do what I'm going to do. And all you should do is compete with yourself. And so, if you're 50 pounds overweight and you're working with the fasting and you're trying to make, progress in that direction, you might feel defeated when you see someone who's like a fit instructor and they're doing all this stuff. You're like, well, I can never do that. Then they get depressed, and then, it kind of the cycle of, not meeting their goals. So you want people to feel successful with their fitness from the get-go. So modifications are totally fine. And then as you get better, you gain confidence in what you can do, and you don't get hurt doing whatever you're doing, then you just keep progressing and you get better and better. And so from a standpoint of all different fitness levels, just compete with yourself.
That's a very good take home and motto. That truly is. It's like, do what you can do and challenge yourself and compete, use yourself as your own competition.
Right. It's, you got to kind of put your blinders on. Like, I don't know about you guys, but like I'd go to Orange Theory classes or like yoga classes or bar classes, and I'm looking at like all the ballerinas, and they're doing all these amazing things, or all these yogis who could like hold one arm and like lift their legs out. I'm like, I can't do that. Or like I'm falling over doing the tree pose or whatever. And sometimes I feel bad about it, but I'm like, okay, I'm where I am, and I'm going to progress at my rate. And so, trying to keep the ego out of it when you're a competitive person is important. Just be like, all right, so I fell over doing the tree. I'm going to get back into the tree pose. Or I can only do 5 push-ups on a bed. Well, that's what you can do. But like in a month, you could do maybe 10.
Right.
So I try to encourage everyone to just keep the blinders on, focus on you, and stay motivated to do your program, whatever that is, and progress. So, I think, like I decided I'm a sports doctor. I believe in fitness and health and prevention and doing all these things, to protect your joints and avoid arthritis and all these things. So I decided to be a Beachbody coach 2 years ago because it was fun and it was helpful for me. And the first program I did, I lost 16 inches because I like started doing weight training. And for your community who's, really trying to be healthy and, maybe lose weight or, find that autophagy and all the good stuff that intermittent fasting does, strength training is really, really critical to weight management. But also we lose muscle every year starting around 30. And so if you metabolism than fat. So muscle requires more energy. So a lot of women in particular, they do cardio, 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 cardio. And I was guilty of the same until I started doing these Beachbody programs. I'm like, oh, I need to, like, I knew I needed to do it, but I just didn't know. I needed someone to tell me what to do. Basically, I needed a personal trainer, but I'm going to pay for a personal trainer every day. So, whatever program you do, if it's, 24-hour fitness or like a Beachbody program, or you do, less meals. I mean, there's all sorts of things that you can choose to do. I just like having a program where it's structured in a way that you're not doing squats every day. You're doing you're doing upper body, you're doing lower body, you're doing core on different days, so that you spread the workout into different ways. So you want to come up with a program, whatever you choose to do, that lets you challenge different muscle groups on consecutive days.
Yes.
That's another way to reduce injury. And like you got hurt doing those, I don't even remember what they're called. I think they're super hard. I'm reasonably strong, but I still have a really hard time with those. So I think a lesson too is, if you're having a hard time with something, that's okay. So be it. The instructor is like been doing this for years and years, and they're super strong. Don't feel discouraged because somebody else can do it who's been doing it for like 10 years. Like, you're doing it for like 3 weeks. So get yourself a break. You're not going to be an expert chef or an expert anything, in just a couple of weeks.
Yes. No, that's true. That's super important. I think, what there is, and I should have asked you before, I'm just thinking about it now, because this is really good, and I want people to be able to view this again. We have an app, or my husband has an app, where I can record the screen. Like, I can record the replay of this and post it. Would you mind if I post it, just like either on YouTube or something like that? People can look at this again and just see how to do a squat and push up and plank and a lunge.
And get some good old fashioned encouraging words.
Yes. Well, because it will record the screen, type in the name of your practice, so that if people watch it and they're in the Bay Area, type out like how people can find your practice, how they can reach out to you. And it also, are you also, if you want to put like your Beachbody coaching info on there too? People may be looking for a coach that actually knows how to actually
do this stuff.
Yeah, do this stuff and actually show you how to do a squat. I think a lot of people will find that helpful.
Well, I think that, I'm uniquely able to help people because I know what gets people hurt. I've seen enough people hurt that I can identify what went wrong. And I do, like, a lot of my job is, a lot of my job is convincing people to not do what they love to do. So, somebody has knee arthritis and they run 5 days a week, I have to negotiate a treatment idea that's basically, okay, well, I want you to run for another 10 years, but you do have pretty bad arthritis. Let's modify what you do, and let's try, yoga. Let's try, weight training and other things to modify so that, you can still do what you love, which is the fresh air and the running. But, I'm like the voice of reason. They don't always like what I have to say, but if their knees feel better, they're going to be really happy. So.
Right. And that's the point. And you don't want to get to the point where you don't want to listen to the advice and now you can't run, period.
Right. Right.
That
Like, this is something, athletes are, and runners, let me rephrase, runners are a very interesting breed of people, and they absolutely love running and they're addicted to running. And if you tell a runner not to run, it's like telling them to cut off their finger or something. Like, it's it's not always taken very well, but I'm here to try to get their bodies feeling better without having to rely on surgery or pills. So I'm trying to help them be naturally better. and mechanics and strength and stretching. You know, those are all really important components. So I usually tell people it's like a three-legged like stool. I'm not doing three legs, three-legged stool. And it's, you know, so it's strength and cardio and flexibility. And if you have all three of those components, you know, if you're tight, you can't work your muscles through their full capacity. So that's why mobility is really important. And if, you know, if you don't have the strength, you're not supporting your joints and taking load off the joint cartilage. And so strength is really important. And like I said before, like we lose muscle mass starting at age 30 unless we work to combat it. But there's a reason like Olympiads aren't 55 years old. They're 35, or that's probably old, you know, they're like in their 20s because they have more muscle mass and more endurance. I mean, there's a lot of reasons, but we just don't recover as well as we get older, and we don't have the same muscle mass, and we have to really fight to keep it. And so, you know, some of your people may be really young, but some, you know, if you're 50 years old or, you know, strength training is really, really important. And if you don't know how to do it or you want guidance, you know, I always say invest in yourself. You know, get a personal trainer in your community who can at least walk you through how to do the right form, and then you can create your own program. So I think, you know, people are really hesitant to spend money. And I think right now, obviously, is, you know, a whole nother thing. But as a whole, I always tell people, invest in your health, invest in your food, invest in good doctors who can guide you towards that, trainers, you know, fitness instructors, yoga instructors. I mean, there's so many people who are really engaged in helping people and giving them like a, you know, a component of the health they need, whether it's a nutritionist or, you know, someone like you or me. You know, so there's a lot of people out there to help, and sometimes you just have to pay money. I'd rather pay money now to feel better and have a trainer or learn how to do things than be in the hospital with diabetes at 60 and lose a leg. I mean, to be completely honest, like that's a lot of pain and suffering, and that's also a lot of, you know, cost. And so spend the money up front to, like, you know, get your car working right so that your, you know, your engine stays healthy. It's like, why, you know, you tune up your car and you get oil in your car and you do all these things for your car, but you don't do that stuff for your own body. And so, you know, maintaining your body is really, really important as you get older. And I'm just super glad that for me, you know, I found a system for me that allows me to get full body strength at home at any time I want to do it. And that's why I like the Beachbody stuff. But there's all sorts of things. I just happen to like that one, you know?
Yeah, there's a ton. I like Beachbody too. I have the subscription membership, the on-demand. So, I mean, you know, put it on in my basement and watch it, and we'll watch it, work out to it.
And watch it and say, hey, they're doing a great job.
Yeah, like, good for them. Good for them. Maybe next time.
I'm going to get off the floor. I don't think I've ever sat on my floor.
But yes, I think it's super important, and I appreciate you taking the time to talk with us. For everyone who's watching now, or if you tuned in late, it's viewable in the stories for 24 hours, but I will go back and record it so that we can have this viewable other times, because you bring out so many great points. And if you guys notice in the notes, I have pinned your info there. So it's right there. So it's been up. So people, like I said, should be able to find you. I mean, I guess if they're doing Beachbody, they can find you wherever they are, because that's coaching and that's
virtual. You know, I mean, I have an Instagram page too, right? So I'm Sports Dr. Nancy. My last name is Dr. Rolnik, Rolnik. But, you know, I think, so on my link tree, you know, if you wanted to do like 14 days of free workouts there, it's in there. Like I show little video clips of what I do just to motivate people. And, you know, some people want to do the sort of stuff I'm doing, and some people are just watching, and maybe they're watching from the couch. I don't know what they're doing, but people follow the workouts that I do, and, you know, they probably have their own version of what they're doing. But on Instagram, I don't always put the workouts in my page because it's too much, I think, but I often have them in my story. So today my kids were in the background and my dog was in the background.
Yeah,
and
I saw.
So there are, I'm always trying to get them to to buy into this fitness thing, and they don't always listen to me. So, moms, dads, don't feel bad. Like, I'm a doctor, I'm trying to get my kids to do stuff, and they're like, nah, I want to do that, So, but keep at it, because it's a good habit to learn early to include fitness in your life, so it becomes like a norm. That, and that's going to affect their health. So for people who want to give their kids everything, and I do anything for my kids, like, lead by example is a good place to start.
Yes, movement is medicine, and give them the gift of health for life.
Right.
That's probably the best gift that you could give
Right.
anybody, right? Is lifelong health and healthy habits. So, well,
Right.
thank you so much for talking with us. This was great. I know you're at the office. We will let you.
I need to go take a shower.
Yeah, we'll let you get home. But I put your infos on here. Obviously, since we're doing this on Instagram, you can go to her Instagram page, Sports Dr. Nancy, and follow her if you're not already following her, for some good information. So we appreciate it, and we will make sure to revamp the challenge to make it a little more. I think we'll challenge people to start off with 20 sets of 3. Or even 20 sets of 2.
So 20 reps with 3 sets.
Yeah.
You said it the other way around. Not 20. Not 20 sets.
Oh, sorry. 20 squats.
Yes.
3 times.
Yes.
But we'll start a little lower. And then for people who have been doing squats forever and need a new challenge, then they're welcome to up it and take it from there. But we'll start more realistic so people can really focus on their form.
Awesome. Well, if you ever want me, I really, really like educating people. Like, I love being a doctor. That's one of our jobs, is to educate. And, one of these days, maybe I can do this like at a conference or something, but if anyone ever wants me to come on their page, or, whatever, I'm excited about changing people's long life health and keeping people active. So,
yes.
Someday
Definitely.
I'll be famous.
Yes, well, I think people will definitely reach out to you, especially seeing this video. And I know there's a lot of different health accounts that follow me as well. And so, especially since this will be in my stories and I'm going to talk about a lot, I suspect you're going to get people who are like, come. You're going to have to start turning people down. So.
Well, I just started a fit group this week. It's called Stronger Together. And so, like, in our little group, we just like take a picture of us exercising and say some positive words, and then you can kind of keep track of your workouts and your goals. And for me, my goal is to work out 5 days a week, and it doesn't necessarily have to be a beach body workout or spinning. It could just be a walk or other things. But I really like my program. I like checking off the boxes that I did things. So it's definitely a positive thing that I've enjoyed.
Yes. No, that's awesome. That's awesome. And so I think the key is, while we are sheltered in place or quarantined or staying home or what have you, there are still ways to be active, but we want to make sure to do it safe, in a safe manner, and allow yourself to progress.
Yeah, the last thing you want to do right now is get hurt. I was talking to some friends on a Zoom call yesterday. They're like, oh, my kids are making a new mountain biking path on our hill. And I was like, well, now is not the time to get a concussion or a fracture and have to have like a surgery for your femur or something. So I kind of poo-pooed it, because I'm like, I envision what's going to happen.
Right.
So,
right.
You don't want to get hurt. And I really want to encourage people to find a way to, set some goals and come out of this. I mean, it's stressful and financially and all these things that are happening. But if you could come out healthier in the end because you started fasting, or you started, meal prepping, or learning how to cook. Like, all these people are home now,
right.
going to restaurants. I applaud the people supporting the restaurants and getting takeout and stuff, but like, challenge yourself to learn how to cook a new dish,
Yeah.
or buy an Instapot, or learn how to cut up vegetables better, or whatever, or try new vegetables. So I think it's a perfect time that you're at home to learn how to cook, and people who cook tend to have better health.
Yes. Yeah. No, all good points, all excellent points. Yeah. Yay, well, this was so fun. We'll have to have you back on. And
well,
sure.
I should have you on my side to talk about the intermittent fasting.
Yes.
Yeah.
whenever, let me
Yeah.
know. I'm
Well, I
always,
love what you've been doing, and we met like I don't know a year ago or something, and
yes,
I've been watching your progression and all the people that you're helping, and it's I applaud all the efforts because intermittent fasting, hands down, is a great mechanism to be healthier, to have good energy, to help your gut, to help your mind,
yes.
and help your keep your weight and your sugar insulin in a good place. So I applaud what you're doing. My husband's doing it. I've been doing intermittent fasting for a while now, and you've given me some good guidance. So I appreciate it.
Oh, no problem. Thank you. I love talking about it. And I think that people hopefully are coming around and realizing it really is a great tool just for overall health, even aside from weight loss, just from health.
Yeah.
It's a great mechanism to help keep healthy. So,
And
and
just like the exercise, you don't have to do it every single day. I'm
correct.
sure you tell people that. So for people who are just starting with exercise or intermittent fasting, if you do it 3 days a week, that's better than you did before. So,
Exactly, exactly. And you build from there. And that's the
right,
whole point. It's like their time of feast and their time of famine, So every day doesn't have to be a famine, right? So
right,
that's
right.
the point there. So well, yay. Let me know. Shoot me a DM and we will link up and go on your page and talk about intermittent fasting.
All right, let's do that.
All
All
right,
right.
you guys, everyone have a good night.
Happy Easter.
Thanks. Yes, that's true. It is Easter sheltered in place, but happy Easter to you as well.
Okay, or whatever you celebrate.
Yes, true,
Okay,
true. I do celebrate Easter, so, but
yeah.
happy everything to everyone.
Okay, have a
All
great
right,
night.
you too.
Bye.
Bye.